It's a horrible thing to think about what it would be like to be sick or hurting and not be able to get any care. I mean, it's hard to even imagine that, but it happens every day. It happens every day to people that are just like you or me, but that for reasons, especially in the economy today, they have no access to health care. They don't have insurance. Their bills are piling up. They're sick, but they ignore it because they can't afford to get any kind of care. Or they try to get care and then they find out how much it's going to cost them. And they just say, no, I'm just going to ignore it. I'm just going to try to survive without getting any kind of help. And that's horrible that in this country people end up in a situation that desperate.
The clinic was an idea whose time had come. And there's nothing in the world that can stop that kind of idea. Nothing. And so this idea moved, and it generated people who really cared, doctors and nurses and pharmacists and lab technicians and volunteers who were willing to come together and provide what I believe is quality care.
We don't know what's going to happen in the coming years with healthcare, but we do know that there will always be a need for this clinic. We do know that there will always be people who don't have access to health care for whatever reason.
It's a vital, dire need. I mean, there was never an end to things to do. I mean, I could probably volunteer every day, 10 hours a day and still not see everybody. But it's a great service to so many people.
We see many diabetics. I've seen people come with abscessed teeth that they've been looking for help forever and just can't find it, and finally just come here and they just can hardly believe it that someone's here willing to take care of them free of charge and volunteering their time to do it. I've seen a woman die of cervical cancer, which could have been taken care of easily if she had been seen months earlier.
To take care of somebody who needs help and have them say thank you means more than any paycheck could ever mean. To have somebody that if it wasn't for this part of the system that we have in place, might not be able to get care. I mean, what more could you want in life, really?
Dr. Nadine Saunders is one of the doctors is the doctor that I see here at the clinic, and she gets on to me about my diet, and that's good. That's a plus for me. It lets me know that she truly cares. And she always says, well, Verdell, my friend, I love you. I don't want anything to happen to you. You're gonna have to do what you're supposed to do to stay here, and I appreciate that, because that lets me know she does care about me.
Your hearts, our hands, their hope.
When the rain is blowing in your face and the whole world is on your case, I could offer you a warm embrace to make you feel my love, to make you feel my love.
Well, I've been coming here off and on for about 10 years now, and they really helped me out. A lot of medical, and I can't get nowhere else, especially with my teeth. My teeth are getting so bad, and that's what I'm here today for. And hopefully I can get in, and I got about 3 broken teeth that hopefully I can get taken care of, through the process.
So having dental problems is a very serious issue, and it causes swelling and infection, and in horrible cases you can die from this. So it's very good that this community has a place where people can come and not worry about payment, and we're open twice a week, and that's really important. Every week, 2 nights a week, that people will come here all year round and do this, and it's great access for people in the area.
I'll be lost if Judea wasn't here, because I think without Judea being here, I will still have this cancer in my thigh. Because nobody will remove, nobody's going to do any work on you now unless you have some kind of insurance.
It's so important to get to these people who need medical care and just don't have access to it any other way. I've seen so many patients here who could have died without medical care, and it's such an easy thing for us to do.
I don't want to be crying on camera. You know, just to talk about it, you know, it gets me emotional. Remember I told you, Miss Kelly?
There are some very, very nice people who work at the clinic. And it's a pleasure to come in each day and spend my time working with the staff of people that are employees at the clinic and also the volunteers that come in. It's a place that the quality and commitment of the people to serve the patients that come in cannot be beaten anywhere. It's tops.
I just love the atmosphere, the tone, and I wish there were more people, more physicians who gave like that. You know, everybody can't have, you know, multiple insurance policies, and everybody can't have the best medication. So I do what I can for the people who I see, and see if I can provide a grade A, #1 treatments for their conditions.
Your hearts, our hands, their hope.
The Judeo-Christian Health Clinic is a place where people can come and get care. They can come and be treated and feel as if they're a human being, not a number. And we treat everybody at the clinic the same as we treat them in our offices. We don't do anything differently. We try to treat them with dignity and respect and give them the helping hand that they need. It's a wonderful, wonderful place. It's also a great statement about the community of Tampa, because it's the people of Tampa Bay helping the people of Tampa Bay. You know, we don't take government dollars, we don't accept United Way funds, we just take the donations from the people of our community who want to help the people of our community. And that's really a great statement, that something like that could continue for 40 years and reach out to those people that are in need.
I think that they trust us and they're willing to help with their health care. They understand our limitations, and that's one of the problems we have here at the clinic, is the limitations on can we get this service for them, and not sure how we can afford to access a certain test or a specialist, and that gets pretty frustrating sometimes when we're just stopped and we know that we need things but we just don't have the money or funding to do it.
The clinic medical care should not be a gratuity, but it should be a right.
If you had somebody tell you you had something wrong with you and you had no place to go, nobody to help you, what would you do? It's going to be awful, awful.
And we went home, we broke the news to our children. They understood but didn't understand the depth of what it would be like, of what I would be going through, because we never really had anybody else in our family that had suffered any of this. We've had other illnesses, but never any kind of cancer close like this. If I had not heard of the Judeo Clinic, I don't know what I would have done. Because you're in a panic mode, trying to figure out who can help you, how you can get help. And unless you don't hear things through word of mouth or family members or even strangers that you can read about or hear about on the news, you don't know where to go. Because we had never been in this predicament before. He's always had insurance. We've always been a family of mother and father always working, and we depended on each other as that way. And when he lost his insurance and not being able to work, I continued to work, continue to maintain the home, but you neglect yourself. The one good thing about it is, yes, I was going through all this, but I didn't have to worry about the extra medical on top of all this, of what I was going through, which they covered it. I mean, yes, there's a little bit of things that I'm having to do now, but that's no big deal compared to what it would have amounted to if they didn't help me with my surgery. There's no way I wouldn't be here. I know that, because I was already at stage 3 in cancer.
If everybody would help, then there wouldn't be a burden on anyone. If everybody would just give a little bit, then nobody would have to give a lot unless it wanted to. But that's our hope, is that other people will join forces and make this community even better than it is already.
Your hearts, our hands.
My hope.